And thank you for joining us live. And to those listening in afterwards, I'd also like to warmly welcome our guests today, who will shortly introduce. My name is Emma Paulino, and together with Stephanie Cole, I will be co-chairing this event for the third series of our FIP Transforming Vaccination globally and regionally. FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. As part of this endeavor, we're pleased to be delivering this event, which is titled Regional Needs and Drivers for Transforming Vaccination in Europe. I will speak a little bit about the whole series and the program that we have designed in order to increase uptake of vaccination globally by pharmacists. But firstly, let me introduce myself and our co-chair, Stephanie Cole, and I will start with Stephanie. So Stephanie Cole holds an LLM in European law and works at the European Association of Hospital Pharmacists. This organization represents and develops the hospital pharmacy profession within Europe to ensure the continuous improvement of care and outcomes for patients in the hospital setting. In her role as Policy and Advocacy Officer, she coordinates and supports the organization's policy engagement on many health policy topics relevant to hospital pharmacists, including but not limited to medicine shortages, antimicrobial resistance, procurement, digital health, vaccination, and the Falsified Medicines Directive. Before joining EAHP, Stephanie worked for a consultancy that supported the European Commission in examining the implementation of European Union legislation, such as the European Cross-Border Healthcare Directive in the different member states. Thank you so much, Stephanie Cole, for joining us today and co-chairing this session along with myself. I'm a practicing pharmacist at my own community pharmacy in Portugal. I'm also general manager at EasyFi, which is a company that engages community pharmacies in the implementation of patient support programs. I'm a member of the National Board of the Portuguese Pharmaceutical Society, and as such, I've been representing this organization at various international organizations, such as the Pharmaceutical Group of the European Union and the International Pharmaceutical Federation itself. I'm currently professional secretary of FIP and consequently a member of its bureau. And I have been previously also chairperson and project coordinator of the Young Pharmacists Group, where I started my interactions with FIP and moved in the different roles in the organization. I'm also currently the president of chairperson of the Pharmaceutical Care Network Europe. Thank you so much again for joining us, and I'm sure that most of you have already had the opportunity to participate in previous events, but for those who haven't and for those who have, I will be making a short introduction on the program. But first, let me make some housekeeping announcements. So this webinar is being recorded and it's being live streamed via Facebook as well. The recording afterwards will be freely available on our website, www.fip.org. You may ask questions using the question box, which is provided, and this is different from the chat function, which you may use to introduce yourself or just mention some experiences and even interact with the overall audience. But if you would like to ask specific questions to our speakers, we would ask that you would use the Q&A box, which is right on the right-hand side of your screen. You are also welcome to provide any feedback to webinars@fip.org and of course become a member of FIP at www.fip.org membership_registration, and you can find the various individual membership benefits as well as the member organization benefits also on our website. We would like to welcome you again to the Transforming Vaccination Regionally and Globally program. This is the first FIP transformation outcome-based online program of its kind, and it's underpinned by the FIP development goals, which we launched together at our virtual event, which took place in September. The final outcome of this program is a historic global FIP commitment to action on vaccination in pharmacy. And we will be producing an FIP transforming vaccination collection. And this collection is a summary and actually a collection of all the experiences and interactions that we've held over a number of events which we have been holding since September as part of this program. So in fact, this series has started, like I said, in September, and it will run through December. Series 1, as you can see, was the first of these 3 series program, and it involved 8 events that looked at the identification of needs to transform vaccination globally and regionally for science, practice, workforce, and education. This involved, this first part involved identifying the needs of the pharmacist and the pharmaceutical scientist workforce to deliver on vaccination transformation globally and regionally. So we looked at elements like strategy and policy for global change, addressing barriers and transforming the workforce with various representatives from member organizations globally, sharing their insights and experiences. Because as you know, we've had a strong uptake of vaccination by pharmacists. So what we used was this platform to exchange experiences on those activities. So the clear and pressing needs of science, practice, and workforce and education were identified in this first series, which led then into series 2, where the needs that were identified were used as a stepping stone to identify actions to transform vaccination globally and regionally through identifying specific mechanisms linked to the FIP development goals. So the second series also comprised 8 episodes that focused on the FIP development goals from the perspective of vaccination to identify actions to transform vaccination globally. This series specifically delivered on the needs identified in series 1 to set transformative goals by deconstructing vaccination in pharmacy. Concrete mechanisms were therefore identified and the tools and structures to enable nations and regions to achieve global transformation of vaccination were then shared in these events, and this led finally to this series, which is series 3. What we will be doing in series 3 is focusing on FIP member organizations across the 6 regions of the world and how they have specifically addressed or will address these actions to deliver on the commitment to transform vaccines globally and regionally. So we will have in this series also 8 episodes and we will identify regional priorities, challenges, and learnings with our members and stakeholders. In today's episode, specifically, we will dissect the first of 6 regions, focusing on the regional needs and drivers for transformation of vaccination in Europe. So this will involve discussing the progress that was made in European countries in the past few years with regards to pharmacist vaccination, the quality and universal access to vaccinations. And I would say that this is a great time to be discussing this as we face unprecedented changes in terms of vaccination, not only in flu, but looking forward at how we will address the COVID-19 vaccination needs. So we will also discuss barriers and challenges and regional needs for future transformation. And FIP members, stakeholders, and partners from the European region will therefore join us for a true regional perspective. Among many others, our main outcome for today is to understand the European perspective in delivering on the transformation of vaccination globally and regionally. And for that, we have identified speakers that will ultimately help us in our objective. We will now move to show a small video for you. Thank you, and this showed us the timeline and the outline for this series in particular, going through the different regions, and as I said, starting in Europe. We would like to also engage you, of course, with you specifically, and please consider answering the following questions, and you can use the chat box for this. What single factor should be prioritized to transform pharmacy vaccination services globally and regionally? What would be the most important achievement in terms of pharmacy vaccination services in your country in the next 5 years? And what else should the FIP commitment to action outline? So we've been asking these questions in our series, and we aim to collect as many experiences as possible and as many views as possible to include in our collection. So please, if you'd like, drop us a line in the chat box or even email us afterwards with your reflections on these questions. So like I've already mentioned, we want to understand the European perspective on this issue, and for that we have identified several speakers who will be sharing their experiences with us. We have a very special guest, WHO special guest, Dr. Niyazi Chachmak, and many additional speakers apart from those already mentioned in this slide. But for the introduction of the speakers themselves, I will now hand over to Stephanie Cole, who will make the introductions as we go. Thank you very much for your attention, and I wish you all a good event. I will be joining for the discussion at the end of the webinar. Thank you very much. Stephanie, the floor is yours.
Thank you, Emma, for the great introduction. And as mentioned previously, I have the pleasure today to co-moderate this great event. And we have assembled a very, very nice group of speakers from all across Europe that we have with us today. Some of them with very difficult names to pronounce, so apologies if I mispronounce any of them. Today's kickoff event will be joined by Hélène Delgut, Monica Direct-Point, Lilian Azopardi, Marianne Saint-Fournier, Lieven Swanepoel, Mesut Sankar, and our special guest, Niyazi Kamak from the WHO Regional Office for Europe. Without further ado, I would like to introduce to you our first speaker, Hélène Delgut, a practicing pharmacy owner from Nevers and the president-elect of PGU, the pharmaceutical group of the European Union. Hélène Delgut sits on the National Council of the French Chamber of Pharmacists, the self-regulation body for the whole pharmacy profession in France, where he oversees all matters pertaining to professional practice and participation in PGU activities. He previously chaired the National Council of Pharmacy Owners of the French Chamber from 2009 to 2019. He's also a member of the administrative and executive boards of the Pharmacist Pension Scheme Fund and a lieutenant colonel in the Nevers firefighters. He holds a pharmacy diploma as well as a master's degree in business management and orthopedic qualifications. Monsieur Delgut, the floor is yours.
Thank you, Stephanie. Good afternoon, everyone. I'm very happy to be here with you this afternoon. And I want to thank you very much for this invitation. And I'm pleased to share with you an overview of vaccination in community pharmacy in Europe. And we are talking, of course, mostly about flu vaccine. You can change the slide, please. It's Yes, thank you. So, like you can see on the two scheme, there is a flu vaccine what can be administered by pharmacists in 8 European countries, namely the Denmark, France, Greece, Ireland, Norway, Portugal, Switzerland, and the United Kingdom. The administration of influenza vaccines in pharmacies has also recently started in some regions of Germany as part of pilot projects starting this autumn. Flu vaccine can be administered by other health professionals. It's the second chain in a pharmacy in Croatia, Estonia, Finland, Italy, Netherlands, Spain, and Sweden. In all other European countries, the flu vaccine cannot be administered in pharmacies. In some countries, including Iceland, Estonia, and the United Kingdom, pharmacists can also administer other vaccines such as pneumococcus and herpes zosters, and in Estonia against tick-borne encephalitis. But let's take a closer look at the situation in some countries. Next slide, please. So Ireland, the example of Ireland. Ireland is a very, very good example. Pharmacists in Ireland have been able to administer the flu vaccine since 2011. Statistics show that pharmacy vaccination increase coverage for people who have never had the vaccination before. Since a pharmacist first started vaccination in 2011, deliveries of flu vaccines through the National Immunization Office, NIO, have increased overall by 50%, and within that, deliveries to primary care physicians increased by nearly 27%, showing that when pharmacists vaccinate, citizen awareness increase and vaccination rates also increase. This service is greatly appreciated because 99% of patients indicating they want to go back to the pharmacy for their next vaccination. And this since October 2020, also following the COVID emergency, pharmacists have also been authorized to provide a flu vaccination service outside the pharmacy premise. For example, the patient's home, his car, nursing home, workplace, sports center, schools, etc., etc. Following the expansion of the flu vaccination scheduled in September 2020, Irish pharmacists can also administer a free flu vaccine to patients in addition to people over 65, like you can see on this slide. Next slide, please. In France, my country, at the beginning in 2016, only 46% of the population at risk had been vaccinated against influenza, well below the recommendation of 75%. In 2017, the French government announced a pilot project that aims to improve the flu vaccination coverage of the adult population by making this service available through pharmacies, also based on a positive data from other countries such as Ireland. In 2 regions, 2,800 pharmacists took part in this pilot project, corresponding to 60% of all pharmacies in these regions. The pharmacists who participated in the pilot projects followed an accredited training course and were supported by the French Order of Pharmacists through a dedicated online platform, which also acts as the data collection point for the service. More than 5,000 trained pharmacists provide 150,000 vaccinations in this period between September 2017 and February 2018. By March 2019, all pharmacists in France were allowed to vaccinate, and 400 million people, so 25%, were vaccinated by community pharmacists. In 2019, from mid-October to the end of December, that was the 2 million people were vaccinated. As regard in 2020, at the present campaign, last week, pharmacists has already vaccinated more than 3 million people, already 30% of the people. In the United Kingdom, in other countries, pharmacists in England, Wales, and Northern Ireland, but also in Scotland, can administer the flu shot. In England, seasonal influenza vaccination by pharmacies was first commissioned locally in 2010 and has been established as a national service since 2015. Now, patients can receive seasonal flu vaccination at any UK pharmacy without any appointment. And you can see on this slide the strong adherence of patients to this service. Next slide, please. In Estonia, during a 1 month pilot project in 2018, nearly 10,000 people received the flu vaccine in pharmacies, administered by a nurse and in a reserved room, not by a pharmacist, but by a nurse. For 70% of this, it was the first time they were vaccinated. The first time is very important. In 2019, instead, 14,000 people were vaccinated against influenza in pharmacies. This example indicates the potential of the vaccine in pharmacy in increasing vaccination coverage. In Denmark, influenza vaccines have been administered by pharmacies for 5 years. Pharmacists must undergo specific vaccination training and keep confidential records for vaccinated patients. This year, on the first day, vaccination opened. 17,000 Danes were vaccinated. In Greece, other country, pharmacists can administer flu shots after a certification program, although there are still discussions regarding the remuneration of pharmacists. And I say earlier, just from last October, in some regions of Germany, pharmacists are allowed to vaccinate against influenza after a long period of training. Next slide, please. The two last countries. In Norway, seasonal flu vaccination in pharmacies developed from a pilot project in 2017. Pharmacies can dispense and administer flu vaccines without a doctor's prescription. However, pharmacies are not part of the public vaccination program and therefore have no possibility of offering the vaccine as a reduced price like the rest of the health service. And in Switzerland, vaccination service for pharmacists have been available at cantonal level since 2015. Each canton individually decides which vaccinations are provided, and consequently, in some cantons, only the flu vaccine is given, while in other, all vaccination under the National Vaccination Plan are available. To provide this service, pharmacists must undergo specific training, including injection techniques and the theoretical aspects of vaccination and resuscitation, and must obtain a certificate. So, in conclusion, what can we say? In each country that offers vaccination in pharmacy, the number of people vaccinated is increasing. We have a wide network across Europe, and the patients plebiscite vaccination in pharmacy. We still have a lot of work to do to convince policymakers about the vital role community pharmacists can play in vaccination. But I believe it. I believe in pharmacists. I believe in you. We can, after perhaps in the answer and the question and the answer, we can explain what for me, what is working and what is not working. Thank you very much.
Thank you, Helen, for sharing with us how flu vaccination services are provided by pharmacists in some of PGU's member countries. Our next speaker will be Monica de Recpoix. She's the Director General of the European Healthcare Distribution Association, EURP. Monica was first appointed to her current position in 2001, and in her role, she represents the interests of pharmaceutical full-line wholesalers in Europe towards supply chain partners and decision makers at national, European, and international level. She was born in Graz, Austria, and has a degree in economics from the University of Economics in Vienna, where she specialized in international trade and marketing. Over to you, Monica.
Thank you very much, Emma and Stephanie, for the introduction, and thank you for inviting me to contribute to this highly interesting as well as highly important session. I will bring a slightly different perspective into the discussion as I'm representing full service healthcare distributors who all have as a backbone of their activity full line wholesaling, which might be more known to you. Now, let me please shortly tell you who we are, and if you could move for that to the next slide, please. So SHIRP is represented in 33 countries of Europe, and our members are there to deliver every medicine to every part in the European Union in order to make this medicine available for European citizens via pharmacies or other dispensing points. Our members have around 100,000 different products on stock. Just to give you an idea, we distribute 62 million packs of medicines per day. These medicines are coming from 3,500 different manufacturers, and we deliver them to 200,000 different dispensing points in Europe. Average delivery time from order to until the pharmacy receives it is 2.5 hours. In average, 35 different products in one delivery, coming from 18.8, so almost 19 different manufacturers. This was just to give you an idea of who we are and what we do. And now we would like to jump into the subject. If we could move to the next slide, please. And we are taking a look to the European landscape of flu vaccines distribution. And Alain Delguet has already paved the way for what I'm going to present to you here. It's a slightly different overview. We have looked at the countries where flu vaccines are distributed via full service healthcare distributors, countries where flu vaccines are dispensed via pharmacies, and countries where, and this was Alain's main point, where vaccination actually takes place in the pharmacy. So you can see that in most countries, with the exception of Czech Republic, there it's not fully available. Distributors carry on stock flu vaccines. When we look at the dispensing sites via pharmacies, only in Czech Republic, Luxembourg, Poland, and Sweden, they are not dispensed via pharmacies. And then when we look, and this was Alain's presentation's first point, when we look in which countries pharmacists can vaccinate, then unfortunately it's still in the minority of countries. Only in Denmark, France, Greece, Ireland, Portugal, Switzerland, the UK, pharmacists are allowed to vaccinate. And what I have learned from Alain's presentation, we have missed Portugal. Sorry for that. This is the picture of the flu vaccine. But now if we want to look into the near future, and if I could get my next slide, please, then we are talking about, and every day you can follow the press on upcoming COVID-19 vaccines distribution. We have made an overview of the vaccines candidates with whom the Commission is in negotiation. Yes, you can see many have already, many advanced purchase agreements have already been signed. You can see the stage in which these vaccines are, the quantities which have been ordered, and then the storage as well as the transport conditions. So what is worrying us is that you can see two of the candidates, which are BioNTech, Pfizer, and Moderna. They have very special storage and transport conditions compared to the normal flu vaccine, whereas the other candidates, as far as it's known to us, they are in 2 to 8 degrees, so normal cold chain as we are used to. And we have to see how we are going to distribute these vaccines based on new technology, which the Pfizer-BioNTech one is in a range of -70 to -80 degrees. This will be a challenge. We also have on the next slide, please, if we can move on. We have tried to track the doses required, the status of approval, which is changing every day. and the technology used as well as the price. And I have to state that the information shown there on these 2 slides is no secret inside information, but we have just followed all press statements in this respect. So as you can see, most of the vaccine candidates could be exactly distributed as the flu vaccine, and we believe that pharmacies are especially important. Pharmacists are especially important player to convince the public about the safety of these vaccines. We hear a lot about resistance and insecurities about the safety of these new vaccines. So there is a lot of communication necessary, and pharmacists are best placed to do so. And with that, if you move on to the next slide. Can I have the next slide, please? So yeah, we think transforming vaccination in the EU, we have also, our sector has a very important role to play there. Community pharmacists are excellently positioned. They are very accessible. People trust the pharmacists, trust their advice. They reduce the burden of hospitals and GPs. And last not least, also due to the fact that they are widely spread out, and we have many, many pharmacies in Europe, also the risk of contamination is much smaller in a community pharmacy than if you go, for example, to a hospital. So our sector is well established to distribute, and we are having the infrastructure to bring the vaccines to the pharmacies, to have a seamless and efficient availability of these medicines. Of course, if we can get hold of the medicines and of the vaccines. And I will not lecture you now about the shortages of flu vaccines, a topic from which we all suffer equally. And it's important that the pharmacists are taking on their communication role towards the citizens. So we think that national governments who are now drawing up the vaccination plans should include and integrate community pharmacies in their national vaccination strategies based on best practice examples, as also shown by Alain in the previous presentation. So we think this is especially important to quickly roll out the COVID-19 vaccines campaign. And it is really crucial that the sector of the community pharmacies is taken into account. Yeah, these were my conclusions, and I hope we can work with all of you in order to make this happen and in order to have a fast and efficient deployment of the future COVID-19 vaccines. Thank you.
Thank you very much, Monica, for providing insights on the work of GERPS members when it comes to flu vaccine distribution and the future distribution of the COVID-19 vaccines, which hopefully will start soon. Our next speaker, Liliana Zuppardi, professor and head of the Department of Pharmacy at the University of Malta and president of the European Association of Faculties of Pharmacy, has prepared a video message, which we would like to share with you.
When addressing vaccination and pharmacy in Europe, a key aspect is vaccination qualifications of the pharmacist workforce. As we reflect for a call for action to provide for pharmacy workforce enablement to contribute to such transformation in Europe, we need to engage beyond the administration skills requirement only. The contribution of pharmacy education to this action is a commitment to support practice skills development within undergraduate pharmacy programs by engaging a science practice focus on vaccinology. By underlining the science, we can contribute to achieving pharmacist empowerment to participate in evaluating safety, quality, and efficacy of vaccines, providing information to overcome vaccine hesitancy, and facilitating access to vaccines, including administration of immunization. How can we merge the science and practice in pharmacy education to respond to this call for action? By focusing on 6 priority areas, namely aspects of immunology, consideration of vaccine regulatory processes, relevance of public health considerations, knowledge on fundamental topics related to stability and safety in the distribution and administration of vaccines, proficiency in pharmacy management aspects of documentation, patient profiling, and collaborative practice with other caregivers, and practice-based skills related to administration techniques, including responding to anaphylactic reactions. This is how education can support the transformation of vaccination in pharmacy in Europe.
I hope you all enjoyed the video message that we received from Professor Azzopardi touching on pharmacy education. I will now move on to our next speaker, who also comes from the lovely island of Malta. Marianne Saint-Fournier is the president of the Malta Chamber of Pharmacists and one of the first Commonwealth Pharmaceutical Association Fellowship awardees. In a career in pharmacy spanning more than 4 decades, Marianne Saint-Fournier, a graduate of the University of Malta, has developed a varied portfolio ranging from academia and research to long-standing professional experience in pharmaceutical marketing and community pharmacy. Marianne leads all delegations for negotiation with the government on all matters concerning pharmacists, pharmacies, medicines, and healthcare, including pharmaceutical legislation, policy, and reform. Under her leadership, the Chamber achieved a landmark agreement with the government on the decentralization of the distribution of NHS medicines through the pharmacy of the patient's choice, which enables equitable access of chronic entitled patients to their pharmacist's professional services and their NHS medicines in the community. Since the introduction of the pharmacy of the patient's choice, she has striven to develop the system to meet patients' needs and empower pharmacists to develop their professional services. One of the Chamber's flagship projects is vaccination by pharmacists, as advocated for by the FIP goal objectives of transforming vaccination. Marianne Saint-Fournier, we're looking forward to hearing from you.
Thank you. Good day to all, and thank you for this opportunity. In presenting our, can we have the first slide, please? Yes, good. Thank you for that presentation, Stephanie. Just a little note about Malta. Malta is small. It's also beautiful, as you all said. It's a small island, 312 square kilometers, but very densely populated, with over 500,000 persons with the last census. As you can see also, the population includes a cohort of over 20,000 migrants. These are mostly third country nationals. You also have a lot of residents who are not Maltese. And so we have an internationalized professional practice with all the challenges and opportunities that that brings. As you see, the life expectancy is 75 years and over. And we do have a large cohort of elderly people, elderly population. Last year, we even had over 3,000 persons aged over 90. Unfortunately, some of these have left us due to COVID, and that is, of course, very regretted. However, it shows that we have the target population, especially for adult vaccination, to ensure better quality of life, prevent infectious disease, and also to sustain our health systems. The average life expectancy, as you can see, for those born in 2019 is 83. And so it's very important that we consolidate good vaccination by pharmacists projects in order to consolidate vaccination today and in the future. Next slide, please. Next slide. So we are, yes, positioned to increase vaccination uptake. We have a community pharmacy network of about 225 community pharmacies which are regulated by geodemographic organization. This ensures equitable access to pharmacists and pharmaceutical services and to enhance the patient-pharmacist relationship. The POIC service, the POIC project, which Stephanie explained in the introduction, is a very important scenario for introducing and consolidating pharmacist-driven vaccination. There is a catchment of 180,000 chronic patients who are vulnerable. These are registered with the pharmacy of their choice. The majority are elderly. The system of the POIC is a web-based dispensing system, so there is a full ICT penetration, and this can be utilized as a very good platform for vaccinating and outreaching to these people, and also to have robust record keeping to be exchanged with interoperable systems with the health authority, with the public health authorities instead. In fact, to assure the data with regards to vaccination coverage. The services, of course, are very easily accessible as all community pharmacies in Europe, and is always nearly open. The community pharmacists are highly trained, versatile, frontline healthcare professionals, and they are committed to continuing professional development. And so, not least in what the pharmacy, Chamber of Pharmacy intends to introduce and update the pharmacists with training, hands-on, and also theoretical and background scientifically and from a practice aspect. With regards to vaccination-oriented activities, the Chamber has been involved in these through the years, because historically, although not within a structure, the pharmacists have had some hands-on training, even at undergraduate level, but also on the technique, but also, of course, from a vaccinology aspect, for example. But of course, this needs to be consolidated, as my colleague, Professor Atsopardi, stated. With regards to the Chamber activities in relation to vaccination, these have been intensified since 2013 with partners and mentors. For example, we take part in Science in the City festivals, which are EU supported, and we go on the streets of Valletta, our capital, and meet the public to promote the pharmacy profession with children from 5 years upwards to the elderly. And there we do also projects, for example, with our with the pharmaceutical industry, in particular with Pfizer. Over 2 years, we promoted meningococcal vaccination, and also the year after, adult vaccination, in particular the pneumococcal one. And together with PGEU and FIP, of course, we want to consolidate vaccination. We follow, of course, the guidance and look forward to the conclusion of the series, for example. We also identify the Irish example as seeing something to emulate. And we have engaged with our colleagues in the association. We are particularly interested in how they've advocated legislatively for the role. We have also champions, what we call champions. For example, the CEO of the Malta Medicines Authority, the Health Promotion Director, Health Promotion and Disease Prevention Directorate head, and also members. Have the next slide, please. Next slide. Next slide, please. Okay. So we were asked to identify drivers. We see an enabling scenario. We are convinced that the optimal national vaccination uptake imperative in the country, both in extraordinary and ordinary times. For example, in extraordinary times are the ones we are living through at the moment. So with COVID vaccine at the doorstep, hopefully, and of course the influenza vaccine, which is vaccination, which is underway at the moment, but not through the pharmacies. And in ordinary times, to promote vaccination, especially adult vaccination and life course vaccination, in order to consolidate and ensure a good quality of life for adults and the elderly, prevent infectious diseases, and even to provide for a sustainable health system. Community pharmacies, as we've seen, are in a unique position in the heart of the community. They are scientific and healthcare experts. They are trustworthy, accessible. They have a multifaceted by academic, professional, and ethical formation. And even I must add that they also ensure the preservation of the cold chain, although the new technology, COVID vaccines, for example, will certainly provide a challenge. However, I mention here because I was struck by a point raised by Professor Di Pasquale in the last seminar of Series 2, which showed the provision of vaccines from concept to manufacture to pharmacies and to patients. And of course, pharmacies do ensure the cold chain, but for example, in Malta, where we have vaccination in the pharmacies, but by doctors mostly, and some patients collect the vaccine and then ask the doctor to vaccinate, and so we see a weakling there, and certainly position pharmacies better to ensure the cold chain. The web-based digital POI system, of course, is ideal, as I said, for targeting the patient cohort. It's robust record keeping and the possibility of data sharing for the health authority. And the Chamber is therefore committed to develop empowering pharmacist-focused, patient-centered services, not least vaccination by pharmacists in pharmacies. Next slide, please. Next slide. Thank you. Barriers. Okay, so let's call them challenges rather, that we can transform into opportunities. We have a strategy. These are what we can consider barriers, but as I said, we can also change these into opportunities. We have a very good relationship with our Minister for Health, who's also the Deputy Prime Minister. However, in discussions with him with regards to vaccination, although he's propensive, however, he sees pharmaco-medical politics as a concern and would like us to resolve these. So we are identifying champions that can help us, also in the medical profession, and we do have some of these too. And we believe that with our good relations with the associations representing these colleagues, we can overcome these so that we do not trample on each other's feet. And instead of protecting territory, we can cooperate and increase, at the end of the day, the uptake. The Superintendent of Public Health, we have held very interesting official and unofficial meetings. The contention is legislation, although we do see some provisions in the main laws with regards to competencies of pharmacies, which would allow the assistance of administration of medicines to patients. And as I said, there's the traditional allowable administration. However, we feel that there should be a specific legislation advocacy, and so we are in consultation. We have already identified the acts and regulations where we need to have the provisos for pharmacists. Also, we would like to see pharmacists prescribing for the adult vaccines like influenza vaccine, pneumococcal, etc. Pharmacists and their comfort zone. Now, we don't really mean comfort in the sense that, you know, it's difficult perhaps for the pharmacists to envisage them coming out of what they usually do, which is already rather restricted from a time factor aspect and also with their present workload. However, we would like to see the supply of empowering pharmacists through professional tools, specific continuing professional development and hands-on training, and the supply of the supplanting by legal authority, and of course the negotiation of a good remuneration package. The majority of the scheduled vaccination is free by the National Health Service. There are also schemes with doctors whereby the free influenza vaccine, for example, is supplied by family doctors, and they charge a professional fee. I've seen an interesting article in the Pharmaceutical Journal very recently whereby the UK is providing, the NHS is providing vaccination through pharmacies with a fee. And that is an interesting proposal. I think this is in the context of COVID. With regards to community pharmacist premises, we feel there is a need to refurbish a bit our pharmacies. Many of them are small. There are bigger ones. We may be more propensive to providing a confidential and private area, but we do have pharmacy clinics on site. At the moment, vaccination is carried out by doctors in these clinics, but in future we envisage their use for pharmacists. And also we need to engage with the public to accept pharmacists in general as vaccinators as part of a national campaign, and also to hone their communication skills. Next slide, please. Next slide. Thank you. And then there are extraordinary circumstances. Of course, we are living in an extraordinary circumstance, which is due to the COVID pandemic. But we believe that we should carpe diem, we should grab the moment. On the one hand, you can look at it as a barrier because, for example, how are we going to organize the hands-on training and actual vaccine administration due to the social distance protocols and to safety? So we need validated safety protocols, and we need to be creative. What about pharmacists' propensity? We need to support and empower them because they themselves may have vaccination anxiety due to COVID-19 and are interested in the safety of their patients, their own safety, and those of their loved ones. The logistics and access to vaccines, we followed with interest the Monique's presentation with regards to logistics. We also have, don't forget that we live in an island, and although we have been adequately supplied on our critical medicines, there's also a factor of the logistics with regards to the arrival of our medicines and of vaccines. With regards to the new technology vaccines which have been procured by our government, for example, we learned that these have to be delivered overland, and of course there are the challenges of the storage with the very low temperatures needed. Malta is one of the small countries that is, one of the states that will be affected by Brexit, and so that is an added matter to consider, which we are monitoring. This can affect supplies, maybe prices, etc., etc. With regards to drivers, from a point of view of COVID-19, I can only conclude on the fact that community pharmacists during COVID have been described by our Ministry of Health as having been and being brilliant. This I quote many times, even in our meetings, because of the day-to-day performance as frontliners, consolidating the primary healthcare needs of patients. They were the first and last bastion, and they are, during the ongoing pandemic. With the help of the Chamber, we spearheaded the expansion of professional services, such as repeat dispensing, doing away with prescriptions within the national health. We'd like to see the expanded and retained even after the vaccines are here and we return to a new normal life, as they say. And we believe that they are a beacon to consolidate the role in transforming vaccination. Thank you very much. Thank you.
Thank you, Marianne, for sharing the experiences of Maltese community pharmacists and the work that you're doing to promote their role, not only in vaccination, and also for touching on the challenges that both Brexit and the COVID-19 pandemic present. Our next speaker is Lieven Swanepoel, the past president of PB, the Association of Pharmacists in Belgium, which is the National Federation of Independent Community Pharmacists, representing over 85% of community pharmacies in Belgium. He was an active community pharmacist for 15 years, interested in professional development, quality assurance in community pharmacy and data. He was also a part-time research fellow for 3 years at the Faculty of Pharmaceutical Sciences of the KU Leuven and conducted research regarding the need for information about medicines in psychiatric inpatients before returning to his calling as a community pharmacist. Lieven Swanepoel served as a member of the Federal Council of APB for 5 years before he was elected as president of the Executive Committee in 2016. In 2019, he also became vice president of RECIP-E, a non-profit association of healthcare professionals responsible for the implementation and rollout of electronic prescription services in Belgium and the president of PharmaFlux, an initiative for data sharing by community pharmacists. I'm now pleased to hand over the floor to Lieve.
Thank you, Stephanie. All that is true. I must admit, hello to everybody. Glad to share some experiences with the pack. And a little more than a year ago, I was able to share with you where we were at the regional meeting of FIP in Ankara. And I grabbed back to a few slides from then. So I started by cheating and telling you that we started from scratch. Actually, a lot was going on already. This is a short overview of the last few decades, since I was born in 1973, and what happened in my life, I'd say, and how that connects to vaccination in community pharmacy. We actually have good vaccination programs for children, but not so strongly developed for adults who are considered to be responsible themselves and to take care of their vaccinations themselves, which is often, of course, not the case. We had some policy developments regarding community pharmacy and vaccination. Until 5 years ago, it was swearing in church if you promoted vaccinating in community pharmacy by pharmacists and not medical doctors. And it was only 5 years ago. Since then, there's lots of discussions been going on. And when we concluded this pluriannual frame agreement with the Minister of Health, prevention, at least in general terms, was confirmed as a important job for community pharmacists. Of course, it was something we advocated strongly with the minister and with all stakeholders, and we keep on doing so, of course. We had elections last year in Belgium. So that's that funny country around Brussels, where it takes a long time to find coalitions and install governments. Well, we visited all parties that took part in the elections to explain them what community pharmacy is about and how it should be recognized and developed in primary care and integrated care. And one of the claims we made is that vaccination in community pharmacy by community pharmacists can increase vaccination rates and bring them up to level, because also in Belgium, even elderly patients, 65 plus, we do not reach the threshold of 75%. It was even going down beneath 70%, not to speak of younger patients at risk, where vaccination rates are often below 50%. So a lot of work to do with success. We were heard and found our claims in several it's then so there I am again. I apparently lost connection. So let's get to the next slide, please.
Hi, Livan, this is Lina. We just keep losing you, just to let you know.
Okay. Shall I go on? Or do we switch to another speaker who has a better contact?
That might be better because we don't want to miss anything you say. Would you be able to log in on a different mobile device?
Yes, I'll find a way. So let's cut it here, and I'll join in right away from another
Take your
position.
time. In the meantime, we might maybe take up a question. Emma, Stephanie, would you like to maybe engage with our previous panelists? I know that Alan mentioned that he would like to share later some of his thoughts on barriers and drivers for Europe. This might be a good junction to do that. I wonder if we can bring back Alan on the line.
Yeah, that would be great. Ellen, would you like to come back on the line to share some information on the barriers and drivers with us?
Hello, it's me. Yeah, thank you. Do you want that? You want? Sorry, because I have a lot of noise in my pharmacy. I am in my pharmacy. You want explain us what work, what don't work, perhaps?
Yeah, that would be great.
Yeah. Okay. There is. I will give you the French example because it's the example I know the best. There is some barriers, some restrictions from the people. People is the French people don't believe in vaccination. For example, for the next COVID vaccination, 1 on 2 French people only want to be vaccinated. They are very afraid about vaccination. And also, doctors and nurses, also some of doctors, not all the doctors, of course, but some doctors are not, don't believe also in vaccination. Perhaps it will be to inadequate training, perhaps. I don't know, but when we have two different opinions, it's very hard after to speak with the patients. And also, nurses and doctors are afraid that pharmacists can vaccinate. It's normal because they don't know what we can do, and they're very afraid about this. So why did it work in France? First, and I tell you in my slide, the necessity to vaccinate. In a country where people are poorly vaccinated, national health authorities had to find solution. When something don't work, you need to find another. You need to find another something new, and the pharmacist is one of these solutions. And second way, patient trust in their pharmacist, where one of the profession patient trust the most. We have also a wide network across our country. Where there is no doctor, there is a pharmacy. So it's very important to have this network. Marianne said us in the slide in this presentation. And like Monica said us also, we need to use a COVID crisis. Each country wants to vaccinate all its population. So they need to work with the doctors, of course, with nurses, of course, but also with the pharmacists. So how to do it? How do we success in France? First, we meet our politician, our national health ministry. We meet them to explain, to show them example, and for France that was the Ireland example. And we show them it's working. So if it's working, for example, in Ireland, it can work in France. The second way is to have public opinions for you. in France, we have a survey in a great national newspaper, and the question was, do you want your pharmacist to be able to vaccinate us? And the answer was yes, of course. And so government will not be worried to give you this possibility. So second way, have the public opinion for you. The third way is to realize a pilot which can provide data. We have provide data of the number of the vaccination, of course, the people who was the first time vaccinated, the number of side effects, and there is no side effects during the pilot. So the French government can see it will be possible to give the vaccination to the pharmacist. The fourth, of course, it's to be irreproachable on the quality. You need to follow a specific training. I think it's very important, because if we work bad, it will be terrific. It's not a good solution. So you had to follow specific training, and like this we are irreproachable. And at least you need to think interprofessionality. You can't be work alone. You can't be alone in your pharmacy. You need to speak with the doctors near you. You need to speak to the nurses near you. And like this, everybody speak together, we work together, and it's, I think, the main reason of the success of the vaccination.
Thank you so much, Alan, for sharing with us the experiences from France and how you tried to convince your country to actually pick up on the vaccination services that pharmacists provide. Lieven is back with us, so I think we have overcome the technical difficulties, and I would give the floor back to Lieven to continue his presentation.
Thank you, Stephanie. We'll see how it goes now. I paid the bill for the internet connection, so it's right now, so it should be better from now on. I'm sorry. So actually what Alain was telling represents the stage we're at. And we took part in the FIP immunization seminar in Amsterdam in 2018 with the stormy weather, and we learned about what experience were all over the world: South Africa, Argentina, USA, and Canada. But especially for us, it was interesting to see what was happening in Ireland and Switzerland, countries very much like Belgium, and have the community pharmacy chain or network organized in more or less the same way. And then we closely followed what happened in France, because when it rains in Paris, you can feel the drops in Brussels, of course. So what Alain is just mentioned is what is going on since then in Belgium, because at that time we put it forward as a strategic priority to develop vaccination in community pharmacy in Belgium as well, learning from what happened around the world. And then we published an international study that was performed by a French professor, actually, but he's a member of an independent member of our board. So we asked him to perform this study, and we got it published. And then if we go to the next slide, you can see that actions like that do help us. We also took advantage of the European initiative by the Commission. And we noticed that an independent survey that was performed by a commercial professional magazine that since 5 years ago now, 2 out of 3 pharmacists are ready to administer vaccines themselves, while a few years ago it caused a big row. Stronger even last year, just before the summit in Africa, or the regional conference, the Royal Academy for Medicine in Belgium published a report stating that flu vaccination should be implemented in community pharmacy right away, and that it should be investigated for other vaccines as well. So that was a great step forward. Next slide, please, where I can tell you shortly what's happened since. And of course, I told you that Belgium is a funny country. We had a government in current affairs since the end of 2018 and throughout 2019, which was election year. So it was hard to achieve change in law. It was in fact impossible. And then, of course, while there was no new government yet, the COVID pandemic struck. There were elections last year in May. So there was a parliament in full competence, and we achieved to get some bills passed, minor bills, but still, through parliament instead of through the government. So we had contact with several parties, and we know that a bill to allow vaccination in community pharmacy has been introduced. It has not been programmed yet due to the urgent matters around COVID, but it is on the agenda somewhere later this year or next year. And then in October, we finally have a new government, new Minister of Health, and we were happy to see that some of the elements in our memorandum could be found in the coalition agreement, in particular the role of community pharmacists with regard to prevention, which equals for us supporting vaccination and immunization. So the question is, what will happen next? I have one more slide to look into the future. I can tell you that training to vaccinate for community pharmacists is being organized. This fall and this winter, we are providing courses to have at least 1,000, is 1 out of 5 pharmacists ready to vaccinate by the spring next year in the north of the country, and in the south of the country it will be started soon as well. And we are advocating, of course, this change in the law, and we are waiting for a new bill to be introduced to reform the law on execution of health professions that should allow pharmacists to pierce needles into people's skin, and then we could start with the next steps, such as pilots and so on. That is in very short what's happening in Belgium, and I hope to give you an update next year about what actually happened in 2021. Thank you.
Thank you, Lieven, so much for outlining how Belgian pharmacists use the experiences from their colleagues across the border to develop their vaccination services. So fingers crossed that next year you can provide us with an update on how you actually managed to introduce the legislative changes here in Belgium. Our next speaker is Dr. Mesut Sancar, Professor of Clinical Pharmacy at the Marmara University. Professor Dr. Mesut Sancar graduated from the Istanbul University Faculty of Pharmacy in 1992. He completed his Master of Science and PhD education in the Clinical Pharmacy program at the Marmara University. In 1998, he was in Nebraska in the United States for observation in clinical pharmacy practice. Dr. Mesut Sancar joined the Clinical Pharmacy Department at Marmara University as professor in 2017. His research areas are mainly on patient-oriented services, pharmaceutical care, patient compliance, pediatric infectious diseases, clinical pharmacy education, and pharmacoeconomics. He has given many lectures and continuing education programs organized by the Turkish Pharmacists Association and the Society of Clinical Pharmacy. He is a member of the European Society of Clinical Pharmacy. Professor Dr. Sancar, the floor is yours.
Thank you very much for inviting us, and I'm very glad to be here with distinguished colleagues. In our country, in Turkey, routine vaccines are generally administered in primary healthcare by family medicine practitioner within the scope of the national immunization program. But there is no immunization program for adults. Flu vaccine and pneumococcal vaccines are under reimbursement in high-risk groups, such as geriatric patients, patients with diabetes, asthma, COPD, kidney disease. These vaccines usually apply in primary healthcare institution. However, before COVID-19, this awareness was not high in the community, unfortunately, especially for pneumococcal vaccines. In Turkey, the administration of vaccines and other injections are not permitted in pharmacies right now, until now. Pharmacists sell these vaccines, but they are not authorized to vaccinate. Especially for the last 20 years, clinical pharmacy and pharmaceutical care courses have been performed frequently, and so our pharmacists have increased their interest in these subjects. However, these education programs and other continuing education, continuing professional development programs mostly focused on the role of the pharmacist in the chronic disease. But we need more specific education and training for vaccination. I think there is no comprehensive training on immunization has not been done yet. As the Turkish Pharmacist Association, different videos on vaccination were prepared and shared with pharmacists. In addition, an e-book titled Pharmacist Vaccine Guide, Frequently Asked Questions, was published also. A poster titled The Vaccine Has No Age has been prepared and will be sent to all pharmacies to increase public awareness of the importance of vaccination. As the TPA, we look positively that pharmacists receive the authority to make vaccines in the pharmacy after a comprehensive education and training, and we are planning pilot studies on these subjects, on this issue in near future. Thank you very much. Thank you for listening.
Thank you very much for sharing the perspectives from Turkey, Dr. Sancar, and for highlighting the role of the Turkish Pharmacist Association in actually providing more education and training on vaccination.
Yeah, you're welcome.
And now I'm very pleased to turn over to our special guest and last speaker, Dr. Niyazi Kamak, who has been working as Regional Technical Officer for Immunization Program Strengthening with Vaccine Preventable Diseases and the Immunization Program of the WHO Regional Office for Europe for the last 10 years. Dr. Kamak is a medical doctor with postgraduate education on health policy, planning, and financing. He gained national experiences on health systems, primary healthcare, and public health, and worked as a consultant of polio eradication in various member states and regional offices of WHO prior to joining the WHO Regional Office for Europe as a technical officer on immunization planning and financing in 2007. Since 2010, Dr. Kamak is leading the immunization system strengthening team with the Vaccine Preventable Diseases and Immunization Unit. The floor is yours.
Thank you very much, Stephanie. It's my pleasure to address distinguished participants of this event on behalf of WHO Regional Office for Europe. I will try to keep my presentation short, but you can benefit from the full set of slides shared. The presentation is going to focus on the immunization policies set at the global level, which also determines the regional immunization policy and as well as immunization policy at country level. And from that policy, I'm going to highlight key focus areas and try to pick up opportunities for the transformation that we are discussing during this series of events. Can we have the next slide, please? So immunization is a success story for global health and development. When we look at the impact of that, 23 million deaths have been averted between 2010 and 18. Huge progress has been achieved in vaccine development, particularly when we are considering the new emerging diseases. And it's expanding beyond childhood, going towards adolescent and adult ages. And innovative ways have been incorporated into immunization services by use of new techniques, digital technology, and other means. Next slide, please. Despite these successes, there are important challenges still prevailing. The benefits of immunization is not evenly shared. Still, there is 20 million infants under-immunized, and almost over 13 million of them do not receive any vaccines. In some countries, progress has stalled, mainly due to hesitancy. Hesitancy is undermining our achievements. And when you look at the disease epidemiology, the measles outbreaks is a good indication of inadequate coverage and gaps of unimmunized individuals. And there's also a need to reach to vulnerable, disadvantaged, hard to reach populations. We need to understand what are the driving factors for low vaccine coverage among them, and how the immunization, how the demand for immunization services could be increased. Next slide, please. So in order to address these challenges, I have mentioned about the immunization policy set for the next 10 years, which is called Immunization Agenda 2030. It comes up with a vision for the next decade, a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. Next slide, please. So this agenda, this policy is shaped by the changing context and challenges. If we can repeat or summarize those contexts and challenges, we need to sustain trust to immunization, improve equitable coverage. We need to tackle with the problem related to population movements. We need to ensure immunization for all ages expanded beyond childhood. Address the problems raised by outbreaks, and optimize and maintain supplies. Next slide, please. So I'm not going to go into details of this immunization policy, which is we call Immunization Agenda 2030. It's shaped by 7 strategic priority areas. So under some selected priority areas, as I said, I'm going to pick up some key focus areas which may ring a bell to you, how you can link your transformation process and its elements with the immunization policy at the global, regional, and at the national level. Next slide, please. The first strategic priority is immunization program within the context of primary healthcare and achieving universal health coverage. So the goal is effective, efficient, and resilient immunization services that are accessible to all people. In that respect, the health workforce that is engaged in immunization program is critical. So the opportunity could be considered as expanding, diversifying the health workforce that is engaged in immunization service provision through partnerships. Another key focus area is the supply chain and logistics. In quite a number of countries, we see the role of pharmacies in that area. Vaccines are supplied to GPs through pharmacies, or in some countries, some vaccines are provided by pharmacists. Health information system is another key focus area, because if you are aiming pharmacists having a role in immunization, they should have access to health information system in order to identify who needs vaccination. And they can also get engaged in monitoring vaccine safety. We see a role there. At least notifying vaccine preventable diseases and detecting and notifying those events to the national authorities. Next slide, please. Second strategic priority is strengthening commitment and increasing demand for immunization services so that the immunization is valued and actively sought by all people and health authorities. So in that respect, advocacy for increased commitment to and demand for immunization services could be a role in terms of key areas. Increasing public knowledge and understanding through awareness building and public education. Building public trust and confidence through being a reliable and accredited source of information for public, and increasing acceptance and raising awareness on value of vaccination through tailored communication to the audience and addressing reluctance to vaccinate. Pharmacists may have a role in understanding and responding to the concerns of public in that area. Next slide, please. Third strategic priority is increasing coverage and particularly equitable coverage so that everyone is protected by full immunization regardless their location, age, socioeconomic status, or any other barriers. So accessing to disadvantaged groups, extending immunization to reach un- or under-immunized individuals and communities, addressing gaps in coverage and equity among certain target groups, population could be a role to consider. And another opportunity could be context-specific interventions approaching to reach poorly served populations. I'm not talking about always socioeconomic status or geographical accessibility issues. We know that coverage, when you look at seasonal influenza coverage on elderly healthcare workers, we are struggling with the coverage. So these are the areas in maybe pharmacists contributing in improving the equitable coverage. Next slide, please. Another strategic priority is life course and integration so that all people benefit from recommended immunization. Previous presenters commented on this issue, the importance of expanding immunization beyond childhood. So raising awareness on the benefits of vaccination beyond early childhood and expanding it to adolescent and to adult or older age groups. Tackling with missed opportunities, tracking the vaccination status and providing or facilitating provision of immunization services to those who have missed vaccines. Next one, please. So the fifth strategic priority is responding to outbreaks and emergencies. So contributing to the detection and notification of vaccine preventable diseases and outbreaks could be an area that can be considered as an opportunity for transformation. Community engagement, communication and engaging with communities should also be considered as an entry point or opportunity. Next slide. So these were the, in a way, opportunities, entry points when you are considering the transformation that you are discussing, brainstorming on. Final slide, with this final slide, I would like to give some strategic recommendations on how to operationalize transformation of vaccination. We all know that implementation responsibility lies at the country level because of legal issues. So at the global level, regional level, you or we may be discussing these issues, but when it comes to action, that's going to take place at the country level. Therefore, advocacy for policy change should be targeted at the country level. We heard from previous speakers, particularly from Belgium, how the policy or the legislative change was targeted. Another recommendation is that it should be, this policy change process should be part of a broader health policy dialogue. Yes, the current discussion is on about immunization, on about vaccination, but we need to keep it within a broader dialogue. I'll come to that later, that issue. It's difficult to come up with a prescription, but as I mentioned earlier in my presentation, I tried to highlight opportunities, entry points, which you may take into consideration. And from the previous presenters, we heard lessons learned from other countries, particularly pioneering countries. It will be good to follow the path that they have followed. It will tell us a lot how to proceed in other settings, in other countries. It's also recommended to target incremental approach rather than radical changes. And we should always emphasize on the complementary role within the entire health system that the pharmacist is going to play. It's also advised to start with functions that do not require legal changes. There's always a role which can be performed, like advocating for immunization, addressing the concerns of the public. These are the areas which will initiate the empowerment process of pharmacists. So community pharmacy, we heard a lot on that, and you have been highlighting the importance of that. It should be based on community pharmacy, this provision of services, immunization services. And lastly, but not least, public health principles are key in planning the transformation. There should be no other concerns beyond that. The public health principles should be driving the process. That's it from my side. And as I said, it was my pleasure to address this group, and will be happy to answer if you have any questions. Over to you.
Thank you so much, Dr. Niyasi, and it was actually our honor to have you present to us today and also to participate in our vaccination series. Thank you so much for participating. And actually, this last slide that you presented is a very nice summary of a lot of the discussions that have been held throughout the series, and particularly some of the experiences that were exchanged here today. So thank you so much for that, and for being so constructive in your presentation. Thank you again.
I'm happy to hear that you found it useful. Thanks.
It was very useful. Thank you so much. We have a couple of questions, so we are a little bit running out of time, but we do have some questions, and the speakers were very nice because they started asking, they started answering the questions already. But in any case, we have some additional questions that are coming in through the chat. So we have a question which is from Mohamed Shiva. Please may one of the esteemed speakers clarify why there are so many different informations about the safety of the COVID-19 vaccine, widespread through the media, some of them against to have such a vaccine. Well, we've addressed a lot over the series of vaccine hesitancy and how people get the information and sources of information, and also how algorithms usually are used by the search engines and social media to keep sending us back what we want to hear. But I don't know whether any of the speakers would like to address this question. Why are there so many questions about the safety of the COVID-19 vaccine? And Lieven, I don't know if you would like to reply to this one.
Well, as I wrote in the Q&A, I'm surely not an authority to have, but of course I have an opinion. It's not a rational matter, of course. We all know that the development of the vaccine and the documentation of the scientific research and etc. is precipitated, so it's not available yet, while it is of high interest for everybody on the world. So there's loads of speculations and disinformation going on, even when it's not deliberate fake news, but there's loads of speculation and interpretation, very often very emotional interpretation out of fear and hope. So if I would be a journalist, I would fill newspapers every day with that topic. And that's what's happening. So let's not worry too much about it, but try to provide consistent, factual and scientifically based information to our patients and to our policymakers in order to find calm and good implementation of vaccination strategies also for COVID-19.
Thank you, Lieven. And I'm sure that, well, as pharmacists, we will be also involved. Of course, it's our professional obligation to be involved in reporting any adverse events that do come up when we do start vaccination against COVID. And this will for sure be one of our roles, besides participating in the immunization services themselves. Also, like you rightfully mentioned, clarifying and educating the population, directing them to reliable sources of information, of course. And we've actually had a question also about reporting of adverse events and reactions, and we did have some replies from Professor Mary Ann and also Alain Delgout. I don't know if Alain, would you like to clarify how this happens in France?
Yes, of course, Emma. Yes, these adverse events, it's very important to declare. In France, it's a legal obligation. You had to declare when there is a side effect, when we constate a side effect. So when there is a pilot project, like in France, the French government asked us to create this network platform to keep and to collect data. And in this data, there is this adverse event we had to declare. And there is no adverse event. Perhaps some blood drops after the injection. But at the beginning, doctors say, "Oh la la, you can see there is somebody. You will kill someone. It's very very dangerous. Pharmacists can't realize the vaccination because it's too dangerous for the people." But on 150,000 patients who are vaccinated, there is no very important side effect. But yes, we continue to declare adverse events on the national register. And the national authorities, HAS, health authorities, said there is no sad event who appear with the vaccination in pharmacy.
Thank you so much for clarifying. It is very important that we reassure the public and also other healthcare professionals that we are reporting any adverse events that occur so that we can inform pharmacovigilance systems, and obviously then those systems will respond accordingly and raise a flag when necessary. So I have two last questions to Professor Mary Ann and also Monica. And Professor Mary Ann, you already replied to a question that we had in our Q&A section about the challenges related to pharmacist vaccination services, and you mentioned that challenges are obviously very broad, legal, inter and intra and interprofessional, time and workload. Obviously, you also mentioned public acceptance. How can we work on public acceptance of this new service that the pharmacist has to offer specifically?
Thank you for that question. Well, I believe that first of all, we are very well placed as pharmacists in community to engage with our clients and patients. So I think it should start there. But as a chamber, we also feel that the pharmacists, we need to help them to hone their communication skills. And we intend to include that in their interaction with patients and clients, especially to support them where there is vaccination anxiety, vaccination misinformation, for example, to put the evidence-based information in simple layman's language in order to encourage the public. Then on a wider level, as was said by one of the speakers, there is of course the public, the media, the social media nowadays. So I think that a good, robust, well thought of public campaign, informative campaign can also help. The survey carried out by the independent newspaper, which was presented, I think, by Levan, I'm not quite sure, is also rather interesting. Of course, these things can also backfire. So well thought of, but there are different aspects where the public can be engaged. But I think basically it's the pharmacist one-to-one relationship that can establish this.